So when we were looking at reducing the waste coming out of our ORs, Practice Green Health was instrumental in helping us get that program started.
The OR was one of those areas that we knew we could get a lot of bang for our buck. Now it's been a challenge. We haven't done everything we need to do in the OR. We are working on some blue wrap. We've already changed their sharps containers to reusable ones. So we're slowly turning that corner with the OR. But the OR is a very challenging environment because they are dealing with patients' lives. And we need to make sure that workflow is part of the process and it works for them.
One of the biggest things that Practice Green Health can do for us is they give us the resources of people to talk to that are doing it. And it takes away from the naysayers of the folks that say, we don't have time, this can't be done, who else is doing it?
Practice Green Health really helped us in terms of benchmarking. So we took a look at all the different things we were doing and were we sort of measuring up to what everyone else was doing. So we're using reprocessed surgical tools. We have LEDs in the OR, we recycle, we're looking at reusable gowns and drapes. It really helped us to know that we were performing at a top level, and it helped us identify gaps in our system. So there are a couple of things that we're going to be working on, and Practice Green Health helped us identify those.
Most of us don't have time to reinvent the wheel. If they're already doing it in Practice Green Health, can give us the resources as to where to find this, and I can just take it and roll with it. It makes it a lot easier for our colleagues in the ORs to grab it and run with it.
We had sharps containers that would go directly into the landfill. Use it once, fill it up, and it goes into the landfill. The containers that we use now are able to use them 600 times. So not only were we able to save a lot of money, but it also protected the environment. We're not putting about 10,000 of those containers in the landfill every few months, which was huge.
We've been able to learn what other people are doing throughout the country. We were the first in the state of Minnesota to do blue wrap recycling, so we were able to learn from others across the country through our relationship with Practice Green Health about what an easy project it was to do, so we could really gain some momentum with that.
Most people know very little about the operating rooms because they're usually in a sterile environment and the doors are always locked and they have big red signs that say restricted area. Behind there are a group of colleagues, people that really do care about the products and the supplies in the environment, and all they're waiting for is somebody to give them the tools and the understanding and the support and the cheering on to do the things they love to do, and that is take care of the patient but also take care of the environment.